Hey everyone, it's Jennifer. It is Thursday, January 21st, 2016. I have not made a post-op update from my plastic surgery, my plastic reconstructive surgery, since I was week 5. So I thought I would stop in. I've been meaning to make a video for the past 5 weeks, and I just haven't. So I am week 10. Post-op of my reconstructive plastic surgery after gastric bypass. I had my gastric bypass in 2012. I kept the weight off for, the whole time. And then I had my tummy tuck and my arm lift done on November 13th, Friday the 13th, in 2015. So I'm 10 weeks out now. I think the last time, trying to think of what was going on the last time I talked to you. I think the last time I talked, I had just been given notice from my doctor that I would be cleared of absolutely everything once all my scabs came off. And I still had scabs on both my elbows, both my hip bones, a little tiny one on the inside of my belly button, which it is my belly button, but when you have plastic surgery, a tummy tuck, they kind of move it so it looks more natural. It's really weird. My belly button is just a lot more, it stretches a lot more open now than it did before. It's weird. So I had a little scab in there, and then I had a scab right at the area where, I have a scab on my abdomen that goes straight down from my breastbone to my pubic bone, and then I have a line that goes this way along my pubic area all the way to both sides of my hips on the side. So that's quite a lengthy incision. So in that T-bone area, right above my pubic area, I had a pretty big scab there too. Ironically enough, I was told on week 6 I would be cleared of everything. They said that the day I had surgery, but I was not cleared of everything. I could not be cleared of everything until all my scabs were off. So ironically, week 6, all of my scabs except my right elbow came off exactly on week 6. The right elbow was the one that split open around week 3. So I wasn't surprised that hadn't come off yet, but exactly on week 7, it did. So as of week 7, I was completely clear of all of my scabs. So I don't have any scabs at all anymore. I think in my last video, I was still wearing my jacket for my arms and my binder for my stomach. I no longer have to wear either one of those. So it's been nice because now I don't, really the only thing I have to do is take a shower, and then I put cocoa butter all over everything, all the incision lines. And then I like cocoa butter so much that I've been putting it on my face, which has made a dramatic difference with my complexion. My pores are so tight now. It's like my skin looks really, you can't tell on the video because this video is grainy because I have a crappy camera, but my skin is much more flawless now looking. It's more porcelain looking. Plus it just smells good. Cocoa butter smells good. And then I just kind of put it on my arms and my legs too because it's winter and it's dry. And so that's that. So showering is really, really normal now. Let's see what else. I don't really have anything else to report other than I was told that once my scabs all came off that I could go to the gym. I could do walking on the treadmill, but that's it. I can't do the elliptical because of the arm things. They still want me using my arms, which is fine because I hate the elliptical with a passion. I hate it. I can't do any free weights or anything like that, but that's fine. As long as I could go to the gym and walk, I was fine. Because as of week 7, when my scabs came off, I was 223. It is now week 10, and I'm down to 214. So I've lost 9 pounds in 3 weeks, and a lot of that is due to, I'm going to the gym 4 or 5 times a week, and every time I go to the gym, I walk. Minimum is 1.5 miles, and that's if I have to take my niece to her tutoring or whatever, I'll go to the gym real quick while she's in her tutoring, and then I'll come right back, so I don't have a whole lot of time. So minimum is 1.5 miles, Saturdays is usually like my big day because I don't really have much to do on Saturdays, so I have more time. So I usually do like 2.5 miles on Saturday. So I'm not walking a crazy amount, and I don't walk super fast. I just make sure that I go, and I make it something that's attainable and something that's not going to get, if I slack off in the future a day or whatever, it's not going to make that big of a difference to my metabolism. But I want to make it easy enough and attainable enough that I kind of want to go, and it's not too draining to go. I have been drained lately because I think my B12 is really, 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 really bad. And the only reason I say that is because in addition to the walking, I'm also taking my metformin almost perfectly as it's prescribed. It's subscribed to me 1,000 milligrams at lunch, 1,000 milligrams at dinner. As of right now, I'm doing 500 at lunch and 1,000 at dinner. I do not have diabetes. I have insulin resistance due to having PCOS, which is polycystic ovarian syndrome, so it's just a woman thing. I'm told that it's gotten dramatically better, but they said I'll always have it, which doesn't, I don't know. I don't know a lot about PCOS. I know that it supposedly goes away once you lose a ton of weight, but my doctor says that I still have it. So I'm on metformin for that, for the insulin resistance part of that. And so the exercise, the metformin, and then I'm also taking probiotic. My endocrinologist, I can never say that word, endocrinologist, I think, told me that in order for bariatric patients, weight loss surgery, gastric bypass patients, to lose weight once they start regaining after a couple years, which it's totally normal to start regaining 10 or 20 pounds. Totally normal. Even if you follow all the rules, you still will regain a little bit of weight, and that is totally fine. You're not going to die. You're cool. But I was gaining like more and more and more. And so he said if I want to lose weight, to reduce my calories to 1,000 calories a day, no less than 1,000 calories a day, because then you start having vitamin deficiencies. But 1,000 calories a day, make sure I'm getting my water in, make sure that I'm taking my metformin, make sure that I've increased my exercise, which I have, and then also take a probiotic. He emphasized and stressed this over and over again. Take a probiotic, take a probiotic. It's over the counter, just take a probiotic. And that kind of, I didn't really put much weight into it, even though that's a pun, didn't mean to make that. I didn't really put much weight into it because I just thought, okay, it's just another vitamin supplement or whatever. But the fact that he kept stressing it, I ended up doing more research, and there's a lot of research that I found online that says gastric bypass patients especially should take a probiotic because our system does not function the way that it once did, most weight loss surgery patients. With the malabsorption issues that we have, and with the fact that part of our intestines are missing, and our digestive system just doesn't function the way normal people's do, we need as healthy of a gut as we can possibly get, and a probiotic does that. I will tell you that since I started the probiotic, I feel so much better. I don't feel as bloated as I was. I don't feel as sick as I used to feel. Gastric bypass patients have a lot of issues with gas, and that's not so much an issue for me anymore. And I'm sorry if that's TMI, but that's just every gastric bypass patient on planet Earth. It's not a me thing. So, but it's a lot of things have improved. So the fact that I've lost, the 9 pounds in 3 weeks, I'm going to attribute to the walking and the probiotic and the metformin, because those are the only things in my life that have changed. But in terms of the plastic surgery, everything's going well. I can show you my arms, but I don't. Dangnabbit, this camera drives me insane. Okay. This is the right elbow, so you can see, it looks like that's a scab, but it's not. It's not. It's rough there, but it's not the scab. But you can see, jeez, I'm sorry. My arms don't look horribly bad. I mean, considering it's only been 10 weeks since surgery, they're not, that bad. I think a lot of that is because of the cocoa butter. It does make a big difference. And I've been massaging it at least once, well, usually once a day or once every day. I get out, I have a personal massager like tool thing, and I use that, and it's way better than if I would just massage it with my hands. And I'll try to do my stomach without flashing anybody. Yeah. So, see my stomach, how I told you about my, I'm trying to do this and it's hard. Okay, see my belly button sticks out way more. But that's my stomach. So, that doesn't look that bad either. I don't know if you can see. If I could move this stupid chair. I don't know if you can see the incisions here. But, oh my god, I'm sorry. I'm trying to fix this. But there, it goes pretty far back. It goes back to like here. And then it goes around the front. So, incision-wise, I'm happy. Like I said, considering it's only been 10 weeks, really all you see is like redness. There's no, that's what I was going to say. A lot of the issues that I am having right now are just scar tissue. I have a lot of scar tissue in my stomach, and not just at the incision sites or along the incision lines. It's kind of all over my stomach, and they're knots, and you can feel them. So I've just been massaging them a lot. Going to the gym, I get bloated a lot, even though I said earlier I don't get as bloated as I did because of the probiotics. I get really swollen, and it feels like being bloated. And then I'll have like really hard masses of scar tissue along that pubic line, that incision along the pubic line. I'll get a lot of just really hard skin, scar tissue, and it'll be very bloated there and very, not bloated, very swollen there. It's normal. I'm told that the swelling will last 6 to 9 months, so I'm not too terribly worried about it. That may be some of the weight loss as well, is that I'm not as swollen as I could be because I am doing the walking, because the walking and the massaging really, really help with my body just feeling better. But physically and emotionally and mentally, I am completely drained. I will attribute part of it to it being winter, and winter's just really, really hard for me. I have bipolar depression, so it's hard for me for that reason. Even though it was warm here in December, it was really warm here in December, so that helped actually, because then I didn't feel as bad. The past couple weeks have been kind of cold, and so that makes it harder, I think, for everybody to want to get up and do anything. But usually winters are really, really hard for me because of my depression, and then I also have fibromyalgia, so when I say my body hurts, it's not just a normal, oh, I'm getting old kind of hurt. It's kind of like, trying to think of how to explain how it feels. If you know what it feels like when you go to the gym and you work out really, really hard, like you kind of overdo it at the gym, and you wake up the next day and it like hurts to sit and it hurts to move, everything's tense and like just completely sore. That's what it feels like for me in the winter, from my head to my toes, including my fingers and my hands. It's just really, I don't want to say painful, because when my back went out and I was bedridden for months, that was pain. This isn't really so much pain as it is just complete and utter soreness. And it makes it really difficult to do a lot of things. I try not to talk about it too much. I try not to complain about it too much because it's an invisible disease, and I complain a lot in general because of my depression. So I try to stay positive, and I try to focus on the blessings that I have, and I try to focus on like the good things that are going on, because I really do have an incredibly good life. I'm extremely poor, but I have a good life. So I try to focus on that stuff, so I don't really talk too much about my fibromyalgia, but it is, it really gets to me some days. And I am extremely fortunate that I have a job and a boss who, I don't think my boss believes anything that I say about when I say I don't feel well, because to him, don't feel well means I have the flu or I have a cold. His boss has chronic pain, so she kind of understands more than he does, but I don't have to divulge that information legally, so I don't. But he's very understanding with me when I say, you know, I'm going to be an hour late. You know, he just doesn't really bring much issue up about it. My work quality is good still. There's nothing that needs to be done that isn't taken care of and done the first time. So I think because of my quality of work, and the fact that everything gets done and it gets done promptly, my level of responsibility, me being responsible in general, I think that helps me a great deal. But I'm very, very lucky to have a job that's so flexible, because any other job I would have been fired by now. I think I've called off since Christmas. I think I've called off twice, and I think I've gone in late twice, and I left early one day. And I really don't have to give too much of a reason, other than I just don't feel well. So it's wintertime, and the incision lines, like today, my elbow, which I just showed you, my arms kind of hurt. The incision lines hurt more today than they have. It's just a day-by-day thing. But overall, I'm doing very, very well, and I'm very happy with my surgery, and I feel so much more confident now than I did before. I don't feel like I'm being judged that much anymore, and the people who I feel like might be talking about me when I'm out in public, or when I hear somebody laughing, I used to think like, oh, they're definitely talking about me, or they're definitely laughing at me, and now I'm kind of like, they might be, but if they are, who cares? And I never had that before. I'm also not so dependent at all on getting male attention to feel worthwhile, which was a big, big issue for me most of my life, where I felt like I had to have a guy's attention for me to have any kind of worth or value. And I don't feel like that anymore. And it's not just because I'm in a relationship, because my relationship is not always good. I don't rely on a man's approval for me to feel good anymore. So, if surgery gave me nothing else, which it has given me a lot, but it has at least given me that gift, and it's definitely worth it. Everything has been worth it. 6 weeks of recovery was rough, but I can see how the benefits will last me forever. So I'm really trying to take care of myself by going to the gym and doing what I have to do to make sure that this was not a wasted effort, because I don't ever want to not feel like this, because I'm finally good. So at any rate, that's my update. I will talk to you guys all soon. If you have any questions, obviously post them below. Yeah, I guess that's it. So thanks so much for watching. Have a really good day, a really good weekend, and I will talk to you soon.